Hello, and welcome to this episode of the Pet Safety Crusader Unmasked. Today we're going to talk about using a stethoscope out of your pet's toolkit, his first aid kit. One thing you might want to start with before you do any procedure with your pet, though, is making sure you're in a good, calm space yourself and using a little rescue remedy for kitty cats or Canine Calm by Earth Heart, just spraying it in the air or a little on your fingers and massaging into the ear tips, just to make sure your pet is in a good calm place as well. Another thing you might want to do before you start is actually wet the fur in the location you're going to use the stethoscope, because sometimes the fur will rustle and make it hard for you to detect sounds. That's why I'm actually using my stuffed friend today rather than my big fluffy Akita. Just some rubbing alcohol, or if that smell is too strong for your friend, just a little damp cotton ball and wet down the fur in the area where you're going to use it, which, as you can see on dogs, is the left side of the chest. Those of you that already know CPCR know that we bend the elbow back to find the target zone when we're going to do compressions. And it would be the same location to listen to the heart. However, we can also use it at the femoral artery to listen to the pulse. Now, as for this stethoscope that is in your first aid kit, these are the binaurals, the earpieces that angle forward as you place them into your ears. You then have the big middle disc. The large side is called the bell, the smaller side the diaphragm. For most of our canines, we're going to use the bell, and we're going to place it right there on the left side of the chest, listening for that lub-dub, lub-dub, lub-dub. Lub-dub is 1 beat, not 2, so don't count it that way. And our medium to large dogs will have a heart rate of 65 to 90 beats per minute. Our smaller canine friends can go as high as 160 beats per minute. So know where in that range your canine friend lies. If you're checking the heart rate of your feline friend, you want to use the smaller side, the diaphragm, and you're going to place that right between the legs at the sternum, right in the front of the chest, listening to her heart rate. In both cases, whether it be dog or cat, it's best to have the animal standing, because if they lay down, the heart might be rubbing against the chest wall. You can also use this as a tool to check the pulse at the femoral artery. Remember, normally we place 2 fingers at the knee and roll them to the inner fleshy thigh. Now we can place the bell in that location and listen for the pulse as well. The pulse and the heartbeat should be the same rhythm, the same tempo. They would just happen in minuscule amounts of time separately, because the heart beats and then the blood pulses through the artery. If you hear anything other than a smooth, steady rhythm, you should have your pet checked out by a vet at once. Also, if you hear any kind of whistling or gurgling, which could be respiratory problems. The stethoscope is also useful to listen to the stomach to see if there's gurgling or the absence of any movement going on there. So it's a useful tool in our first aid kit, but as always, we are pet first aiders, not veterinarians, so we want to be on top of things and notice when something isn't quite right with our pet, but get them to the vet to most quickly get them diagnosed and get them the help they need. I'm the Pet Safety Crusader, teaching you how to use a stethoscope on your canine or feline friend.